So what are some causes of autism spectrum disorder? First, there's the genetics. There's studies that were done with families and twins. If one child does have autism spectrum or is autistic, 3 to 5% of the other siblings are at risk for also being diagnosed with autism. It was interesting that with the twin study, that if one identical twin did have the criteria for autism, that 65% of the other identical twin also was at risk of also having some of these criteria. But with fraternal twins, it's no greater risk than of another sibling, which is 3 to 5%. There's also candidate gene studies where they've tested different genes. There's association and genetic disorders. Also tends to be associated with other genetic disorders, excuse me. It's not yet known, but environment does play a factor and influence in this gene expression and also in some brain development. Also, there's brain structure and function in autism spectrum disorders. Neuroimaging techniques have been used to study brain development and function, and children with autism spectrum disorders have a greater volume of white matter in their cortex and cerebrum at infancy and adolescence. They also may be abnormal genetic regulation of early brain growth. Other causes that they've looked into is obstetric complications. And they have not really come across any specific studies that there have been any specific prenatal or birth complications with development of autism spectrum disorder. They've talked about different environmental exposures, different substances that result in birth defects. There's no known environmental chemical or exposure, but there was a study back a few years ago with Bricktown in New Jersey that there was such an increased number of children with autism, and they also are performing different studies on high levels of mercury. In different maternal medications, drug abuse, chemical and radiation, they feel that there could be some possible side effects. With vaccinations, there's significant controversy where measles, mumps, rubella, some studies prove that there are some scientific circumstances that could affect the child. There's different infections with prenatal infections, an increased risk with rubella, the increase of cerebral palsy, intellectual disabilities, visual impairments, and it's also shown with an increase of autism spectrum disorders. Next, going on, that with gender and autism, there is a 4-to-1 male ratio to female with predominance. But the ratio is 1-to-1 with a child who has an IQ score of less than 50, and those studies continue to go on. Some early identification of autism spectrum disorders. Symptoms must be present by the age of 3. There is delayed language development, repetitive behaviors, atypical social behaviors, and early diagnosis is based on the recognition of some of these core features, and that do appear in early childhood. Atypical development is associated with pretend play, pointing to shared interests, use of eye gazing to another person, and that actually can occur as early as 18 months of age. So what are some of the evaluations of a child with autism spectrum disorder? Well, it requires an assessment, which can take a lot of time, and you need to collaborate with family, school, healthcare providers. A couple different ways. There's a multidisciplinary assessment. Most are first referred based on a school assessment, and it should involve the receptive and expressive language, some cognitive function, hearing, fine and gross motor movement, social and emotional skills, some adaptive skills, and if suspected, the child should be referred to an experienced professional. Diagnostic measures. This is based on the application of the DSM-4 TR criteria, and it's the input of parents, therapists, and teachers. And laboratory testing. There's no standard medical testing to this date. They do some DNA analysis. They do MRIs and EEGs, but it's very low information that they can provide with proving any of the autism spectrum disorder.